2022-2023, which have also been audited and certified by the Auditor General, and these issues that were previously reported in the Auditor General's report for the financial year 2022 have been rectified in the subsequent financial year 2022-2023, and therefore the issue stands addressed. I submit. Thank you, Chair. The next issue under financial statements is unsupported expenditure on food and ration. The statement, and I read the issue, the statement of financial performance reflects medical or clinical cost of Kenya shillings 79,656,011 as disclosed in Note 15 to the financial statements. Included in the amount is Kenya shillings 19,721,369 incurred in the purchase of food and ration that has not been supported by way of receipts in the stores, issue notes from the store, and the bin cards. In the circumstances, the accuracy and completeness of expenditure on food and ration could not be confirmed. Honorable Chair, the management submitted the responses to this issue, and I can confirm to the committee that the relevant payment vouchers supported by the store's records, such as the receipt ledgers, that is S3, counter receipt vouchers, S13, and counter issuance vouchers, S11, all have now been provided, and the auditors have verified the documents, and therefore, to the best of our knowledge, this issue has been adequately addressed. I submit.
CC. Why was it not provided on time to the auditor?
Thank you, Chair. I'll ask CC Health to respond.
Thank you, Chair. Allow me also to ask the accountant in the hospital to facilitate the answering. Thank you.
Thank you, Bwana Chair, on that. These are the information that were there on the vouchers, and when we were responding to the ML, we actually provided. When we were responding to draft report, we actually responded these issues, and they had promised, the auditors had promised by then to remove that item from that, but unfortunately they didn't. But from the records that we have now, we have actually photocopied everything in these responses, and it was there before. Thanks.
And you address as Honorable Chair, not as Mr. Chair. So, Auditor.
Response or next issue, Honorable
Response.
Chair? Okay. I want to confirm to the committee that the audit process is very elaborate, and each and every step is documented. So when these documents were requested, we have the documents, and we use a management system, an audit management system that documents all these. And therefore, I want to confirm to the committee that the documents were provided after the audit process.
Since it is marked addressed, next issue.
Thank you, Chair. We are going to the next part of the report, and this is the report on effectiveness of internal controls, risk management, and governance. Issue number 1 is lack of risk management policy. During the year under review, the hospital did not have a risk management policy in place, contrary to the provisions of Section 158(1) of the Public Finance Management County Governments Regulations 2015, which states that the accounting officer shall ensure that a county government entity develops risk management strategies, which include fraud prevention mechanisms, and the county government entity develops a system of risk management and internal control that builds robust business operations. It circumstances, the effectiveness on risk management could not be confirmed. Honorable Chair, the management provided a risk management policy, but the policy that was provided belongs to the Bomet County Executive and therefore fails to identify or address the unique risks associated with the hospital. And therefore, to the best of our knowledge, the issue is not addressed. Thank you.
CC.
Honorable Chair, we agree that we did not have the necessary risk management policy because we were operating using the county. But we have since set up a team to look at the uniqueness of our risks, and that will be addressed. Thank you, Chair.
Why did you supply this as a policy, yet you know this is still a draft?
I think it was noted later on that this had not been passed through the Assembly, but the policy looked complete, and our team had been using it. I think it was an oversight, Honorable Chair. Yeah?
Page 11.
Page 11.
Page 11 of the policy, the draft policy.
Where is it?
And read for us.
It's empty. Honorable Chair, it is empty, and we apologize for that.
12, page 12,
Same thing.
next 12, yeah.
It is still empty?
Is it side?
No. Honorable Chair, it is not signed.
Then give us the timelines to comply.
Honorable Chair, I will request that you give us 2 weeks because we are developing ours and it has to go through the cabinet. Then we'll
2 weeks really practical because after ratifying in the cabinet, it has to come to the assembly.
No, I mean to reach the assembly because we'll be giving it to cabinet.
So once we resume,
We can provide that.
you will forward it. The executive will forward to the assembly.
Yes, Chair.
And also, when you don't have a document, it's not prudent to put a blank paper. It's better even to say we don't have this than to put a. I've struggled to read, but I can't see it. Next.
Thank you, Chair. The next issue is on failure to maintain an asset register. Records provided for audit reveal that hospital does not maintain an asset register for its movable and unmovable assets. This is contrary to Regulation 171 of the Public Procurement and Asset Disposal Regulation 2020, which provides that an accounting officer of a procuring entity shall be responsible for maintaining a register of assets under his or her control or possession. In circumstances, internal controls over asset management could not be confirmed. Chair, we have reviewed the responses and the documents, and whatever the management has provided is not a register, but it is equipment inventory checklist dated 30th June 2024, and therefore it does not address the issue of 30th June 2022, and therefore the issue remains unaddressed. Thank you.
CC.
Honorable Chair, allow me to request the Director, Health Services, to give a comment.
Honorable Chair, thank you. We acknowledge the comments by the auditor about the maintaining the asset register, and as the management, we shall endeavor to put this in place and work closely with the Department of Finance so that we comply with the requirements of the law. So we'll be able to update the inventory and the asset register and supply the updated register before within the shortest time possible.
Members, if you don't have an issue on that.
No, I have an issue.
Yes.
Honorable Chair. Maybe do we have that's supposed to be used?
Thank you. Before I go to the standard, this issue is majorly on is a non-compliance issue, and in our reports we have indicated the various sections of the laws that have been breached by not having the assets registered. And to directly answer your question, Honorable Member, yes, there's a template that has been issued, and the template is in the Public Procurement and Asset Disposal Regulations 2020. When it comes to the reporting part, that is now the financial statements, the standards as you ask, yes, there's a template that has been issued in the annual financial report, which we call the reporting template. If you look at that, the template, there's a very elaborate template that is given by the Public Sector Accounting Standards Board. And now what the preparers of the financial statements are supposed to do is only to fill that statement, replace those figures using the actual figures as per their records. So yes, we have templates both for the financial reporting and for the asset register, well documented. Thank you.
Now, maybe Chair, the OAG has said there is a template. Do these assets listed here comply with the template?
we will consult with the relevant departments, because there is the Department of Lands, there is also the Department of Finance. Then we are advised accordingly, and we'll, with advice of what the AOG has said, this is a lesson that we've learned. Thank you, Chair.
And why I went to an extent of asking whether Longisa got a qualified accountant is that, you see the AOG say it is in the portal. So it's only about complying, and it's not about only the audit for Longisa. You liaise with the entire Department of Health, including headquarters, so that you comply nicely. I think that should be the position. Director?
Yes, Honorable Chair, thank you. Some of the assets that we have in our facilities, especially Longisa County Referral Hospital, was under the program for managed equipment service, and we were not able to be facilitated with the value of those assets. So in terms of complying with the template, we were not issued with the nominal roll when the equipment were issued, because the execution of the contract was done at the level of a national government. So with the onset of the MES program, cycle has already expired, and now we are entering into national equipment service program, NEST program, which counties are now involved. So we believe moving forward, we would be able to get nominal roll for assets which will be given to us. So we were not able to get, that's why we were listing the inventory without the value, because we didn't get the nominal roll. Thank you so much, Honorable Chair.
And
thank you, Honorable Pushene.
Chair, thank you, Honorable Chair. We would like to know the ownership of these equipments, because we were made to understand that there are some equipment that are leased and there are some equipment that belongs to the county. I think in that template it should address the ownership of the equipment. And what is the current status of these equipments? Do they belong to the national government or the county or the donor? Because some of us, we don't know what kind of equipment is this, because I'm seeing there is an equipment called Derota, and some are made in Germany, some are made in Italy, Brazil. So we don't know what kind of equipment is this and what value.
Director.
Thank you so much, Honorable Chair. To respond to Mheshimiwa Bushene, the challenge that we had was during the managed equipment service, we were not issued with we were not issued with the list of the assets where they were brought to the county. And I think it has now been cured with the new program for the national equipment program, where counties actually participate in the requisitions, even if the support is from the national government. So it's actually the learning point from the previous program, which actually is curing moving forward. And some of the equipment, like now the CT scan at Longisa, it is broken down at the moment, and it was under the managed equipment service. It's a service that we require. It's only that the contract was executed at the national level, and when we tried to contact the company that installed, they informed us that the contract has expired, and they gave us a quotation of 10 million, which we didn't have in our budget. So we believe now when the counties are involved in the new arrangement, we would be able to actually even have a nominal role on the assets that come to the county. So there are issues which I believe will be handled. There was a committee for transfer of assets from the national government. I believe those are the issues then we can put forward so that we can settle that matter conclusively. Thank you so much, Honorable Chair.
And again, when we retreat for report writing, we will make some recommendation as a committee on that. Next, AOG.
I think that's all, Chair, Honorable Chair.
So
in summary,
yes.
Longisa County Referral Level 4 Hospital during the financial year ended 30 June 2022 had 4 issues. 2 issues under report on the financial statements and 2 issues under report of effectiveness of internal controls, risk management, and governance. So the 2 issues on the financial statements have been addressed. However, the 2 issues on report on effectiveness of internal controls, risk management and governance have not been resolved. So 2 resolved, 2 not resolved, totaling to 4. Thank you, Honorable Chair. I submit.
Thank you. The next report is on report of the Auditor General on Bomet County Financial Locally Led Climate Action FLOCA Fund for the year ending 30th June 2023. And we have 12 issues, and for the interest of time, we move with speed. Proceed.